Hi class, my name is Brennan Ellerbusch, and today I'd like to talk to you about a career that you may or may not be familiar with called physical therapy. Physical therapy is important in everyday life and affects thousands of people across the world every day. Personally, I am not a physical therapist, however my mother was a physical therapist previously, and I've also done my own extensive research on the subject. Chances are that if you've ever injured yourself or had muscle pain that you couldn't control or needed rehabilitation, you've probably gone through physical therapy. For the rest of my speech, I'd like to go over the history of physical therapy, what a physical therapist does and where they work, the pay involved, and finally, how you yourself can become a physical therapist. So, let's start with the history. In the article ABTA History, formed by Amber Neal and published by the staff of the American Physical Therapy Association, in 1921, the Women's Physical Therapeutic Association was formed and is known as the first official organization for physical therapists in the United States. This organization was completely women. However, in 1922, the American Physiotherapy Association was created and men were admitted. In 1930, there were around 1,000 members within this organization. However, once World War II started and the polio epidemic arose, this number grew to 8,000 as the increase in demand for physical therapists grew. Programs across the United States also increased from 16 to 39 during this time, nationwide. In 1960, the American Physical Therapy Association was formed, and this had around 15,000 members. Finally, today, the APTA is headquartered in Alexandria, Virginia, and has around 95,000 physical therapists. Now that I've talked to you about the history, I'd like to talk about what they do and where they work. In the book, The American Physical Therapy Association, Book of Body Maintenance and Repair, written by Steve Vickery and Marlon Moffat, they talk about the types of pain that a patient could be experiencing and how the physical therapist could treat it. First, the physical therapist has a patient, and they create an individualized plan together, which the end goal is to alleviate functionality problems and limit pain. Some types of pain that physical therapists could aid in are neck pain, back pain, strains, bone fractures, and even arthritis, and many more. These individualized plans include weekly, bi-weekly, and monthly plans, which include stretches, exercise, and even hands-on physical therapy in the person's home. In the article Physical Therapy Job Settings by Laura Inverarity, published by the Very Well organization, she says, "The thing that makes this practice different from other occupations is the variety of job settings there are to choose from. Some of the job settings you could find yourself in are a hospital, in specialized departments such as oncology, cardiac rehabilitation, or orthopedics, outpatient sources, sports medicine, schools, and even the patient's house." Now I've talked to you about what a physical therapist does and where they work. I'd like to briefly explain what the pay involved is. According to the Bureau of Labor Statistics Outlook Handbook, updated in 2016, the median pay for a physical therapist is $85,400. This number could vary, however, depending on the type of physical therapist you are. For example, if you are a home care physical therapist that would visit a patient's home to administer physical therapy, they could make upwards of $93,200. On the flip side, if you work as an independent physical therapist in your own office, you can make as low as $81,220 working full-time. Now that I've talked about the pay involved, I'd finally like to tell you about how you can be one yourself. There are a couple of steps involved in becoming a physical therapist. According to the Bureau of Labor Statistics Handbook, updated in 2016, one of the most major parts of becoming a physical therapist is achieving your DPT degree. Some prerequisites for this degree are anatomy, physiology, biology, and physics. During your studies in college, as well as these classes, during your studies you must also complete 30 weeks of clinical work while you are still in college. Finally, once you've graduated and completed that 30 weeks, you must apply for a residency, which lasts 1 year post-grad. Finally, once you have completed the residency to a satisfactory level, you will finally be able to apply for your license. In order to achieve your license, you must complete the National Physical Therapy Specialties exam. Once you have completed this, you will be an officially licensed physical therapist. In conclusion, I'd like to go back over my 4 points. My 4 major points covered in the speech were the history of physical therapy, what a physical therapist does and where they work, the pay involved, and finally, how you can be one yourself. Physical therapy has helped thousands of people across the nation alleviate their muscle pain and functionality issues. Thank you, and I hope that I was able to pass some of my knowledge on to you.